have 42,365 cases that are negative. Sorry, I shouldn't call them cases, results, lab results that are negative. And that is up 1,391 from yesterday. And that puts the state at an 8.7% positive to total cases. Of the total cases that are positive, 8.7%. The number of hospitalizations at the state level is currently 1,153 in total, and that is up 32 from yesterday and continues to be 29% of those that are being tested and are positive for COVID-19 need hospitalization. Deaths in the state, that number is currently at 205, and that is up 8 from yesterday. Hopefully by Monday, we have been talking with our regional partners, and we're hoping that by Monday we'll be able to report some regional hospitalization numbers so that you could have a better idea of how many across our region in various counties, and we'll define that more early next week, but we're going to hope to report that coming up on Monday as well. The big change, of course, is the extension by the governor's office and Secretary Palm at the Department of Health Services with the Safer at Home order. So that will take effect on April 24th and will go through May 26th. There are some changes that you may already be aware of, but I'm going to highlight a few changes relating to that Safer at Home extension. So first and foremost, non-essential businesses will now be able to do curbside pickups, deliveries, and mailings. So there are some aspects that non-essential businesses can do going forward once this new extension takes effect. In addition, essential businesses will have some additional precautions to be taking. And again, I think in our county, a number of our businesses are really well prepared for that because we've been talking with them for the last week and a half to be prepared for and able to assure that only a certain number of individuals by square footage in the store are really in the store at any given time, and that as individuals or customers are waiting to get into the store, that those would be socially distanced in an appropriate way so that they are not coming within 6 feet of each other. So I think those are really good precautions that many in our county are already taking and will be moving forward as a requirement under the Safer at Home order extension. I do want to just indicate that while it feels like the Safer at Home order extension is difficult, that there really are some positive things associated with this. First and foremost, I think we need to remember that though we are not still allowed to do anything other than essential travel, we are more than welcome to go outside in our yards and go on walks and try to get physical activity in. We can go to the park, we can go to trails that are open, and now we'll be able to go to golf courses if you're someone who enjoys being outside. Although there will not be the opportunity to do golf carts, I think that is a place where we can add additional opportunities for being outside and getting fresh air and trying to stay healthy in this time when our movement continues to be restricted. Again, just want to give a kudos to all of you out there who are continuing to do such a good job with all of the important aspects that we've asked all along, with washing your hands and not touching your face and maintaining social distancing and not congregating with others outside of your household. So just a reminder that those actions continue, and that is really significantly positively helping our county keep case numbers down. I can assure you that that is the case. We want to acknowledge that there are some questions that we have been getting, particularly in the topic of campgrounds, and I will be having a conversation later today to discuss at present, my health order in relation to campgrounds being closed in the county remains in effect and continues with the extension of this order, but I will be looking at it to see if there are any opportunities for adjusting that order. So just so you know that I'm going to be looking at that, and I acknowledge the questions and appreciate feedback that we're getting from others, and so we'll certainly be taking a look at that. So I think that's, I'll stop there for now, and I'd like to turn it over to Dr. Todd Mahr, Pediatric Allergist at Gundersen Health System. Thank you, Todd, for being with us today.
Sure, my pleasure. I don't know if you can see me yet, but I'm at least unmuted, so we'll go from that standpoint. Start my video. There we go. There we go. All right, technology. I have to click the right button that says the right thing, so we'll get it right. All right, so I'll start and just up front talk about two things that have come up at this point in time. One is asthma and COVID-19. We had a lot of questions of asthmatics and their parents calling in wanting to know, will my child be more susceptible to get coronavirus with asthma? And the answer to that is no. All right. The second thing is my child or I with asthma, am I a greater risk? And we have some mixed data on that. Some of the data coming out of China told us, yes, probably so. There's just recently some reports coming out of New York where they've been able to analyze some of the patients in the hospital in the ICU, showing that asthma is not disproportionately seen there. So that's good news. But I think that needs to be looked at from the standpoint of, we've done a good job of getting the message out. If you have asthma, make sure your asthma is controlled. Don't go off your medicines, stay on all your controller medicines. You know, now's not the time to discontinue anything. So I think we did a nice job of having that message out there. We do know from other coronaviruses that they can trigger asthma a little bit. So there's other strains of coronavirus out there, and they have in the past triggered asthma a little bit. So that was our concerns. So if anybody listening, anybody out there has asthma, please continue to take your controller medicine. Make sure you have enough of it, and be in touch with your primary care provider taking care of you so that you're managing your asthma correctly. The second thing is a very timely thing with the weather warming up and us getting into spring, and that's spring allergies. And so everybody's been alerted to watching for cough, congestion, things like that. And the problem is that's seasonal allergies for a lot of people. So how do you tell the difference? So allergies, tree pollen will start about now. Trees are starting to bud out. In about 3 to 4 weeks, we'll get the grasses, the wild grasses starting to grow more. So what we look at there is runny nose, sneezing, congestion. You do not get a fever with allergies. So one differential would be fever. You don't see sneezing with coronavirus. It's not one of those symptoms that we see a lot of. Coughing could be both. I mean, the coughing from allergies is more of a postnasal drip, more of a wet cough. The coronavirus cough initially starts more dry cough for most people. So cough, you have to put in both columns. The two things to help you as somebody who's suffering is, wait a minute, if I caught coronavirus, if you've got a fever, if you're coughing, if you're congested, then you should be talking to your provider. If you normally have spring allergies, you're starting to sniff, snort, sneeze, and don't have a fever, it's probably your allergies, and you need to take care of your allergies. So there's a lot of over-the-counter medications you can take. If you have any questions, call your provider. So I think those are some easy things to kind of think about as to asthma, keep it under control, allergies. Well, you know, coronavirus is not going to stop us from having spring allergies. The trees are going to keep blooming, and golly gee, I want that to happen after this past week of winter again. So all of that's going to happen, and it'll be great. But you know, if you normally have spring allergies, now's the time to probably start your allergy medicine. Jen, any questions specifically you might have?
No, I think what's helpful is, you know, I've heard from individuals that have talked about where they've been out and about for essential travel and they might have a cough. And I think it's just that reminder that, you know, this virus doesn't discriminate, neither should we. We don't know and shouldn't judge others that if they have a cough, it may be from allergies and not from coronavirus. So I think maybe just speaking to you know, that as humans, we should not judge and make sure that we're being kind to others. And, you know, we should be wearing our face coverings when we're out and about.
That's a good point. That's what I was going to raise when you started speaking. It was like, now's the time to us to really think about wearing a face mask out there, that we should wear that in case you are coughing and sneezing. You know, the mask, as you've talked about, it's not to really protect me, the user, it's to protect everybody else from me if I cough or I sneeze or, you know, expel anything from my nose or my mouth. So, you know, if you have allergies, boy, the nicest thing you could do is to make yourself a mask or a covering and wear it when you go outside, so that if you have sneezing fits, Oh, you'll have something to wipe it on inside, which would be great, but you'll keep it from spreading elsewhere. So that's a very good point. Any questions from the media that might be on?
So I think we could take any questions from the media for either Dr. Mahr, specifically relating to allergies or asthma and COVID-19, or any other topics for me if you have questions.
I have one that kind of relates to both of you. I know you just got done talking, doctor, about pre-existing asthma, but we're hearing from people wanting to know how many of our local COVID cases are people with pre-existing health conditions, which kind of made them more susceptible to it. And if you wouldn't mind speaking on that.
Well, that one I would turn over to Jen, because I don't know all of the cases that we've had for COVID here and can't speak to that. So a lot of that's protected information, but Jen might be able to answer that either now or at a later date.
Yeah, I can answer that actually. So with the 26 cases that we've looked at the data analysis relating to, we've seen that about 60% of those have underlying health conditions. And that might be something like asthma, but it could also be other things that really decrease your immune system. Things like autoimmune disorders and other maybe heart disease and lung disease, things like that. So about 60%. And what's also intriguing is to note that about 67% are individuals that are under the age of 60. So we have individuals under 60 that also have pre-existing health conditions that make it difficult for them to combat COVID-19.
And just a follow-up to that question, I know we've talked a lot about kind of the people who've contracted it, and we've talked briefly on the people who have recovered, but from those people who have recovered, in general, how are they doing? Are they back to their normal lives, or are they dealing with kind of some of these long-term impacts that COVID has kind of held on?
Yeah, so thank you, Justin. The question is, what is the status of those that have recovered from COVID-19? And yes, to my knowledge, with the team that has been in contact with individuals, other than those that are not yet recovered, the ones that have, I have heard their symptoms are greatly improved. And I think with as much as is considered normal under the restrictions that we're in with the safer at home order, for example, I think they are able to return to their normal daily activities within their households.
Hey, Jen, this is Mike. Quick question for you. Yesterday, the governor talked about testing, and that's going to play a pivotal role in this extension of the stay-at-home order. I know we have the capacity for just over 7,000 tests per day in the state. Do you know how many tests are being done right now per day on average?
Yeah, so what we know is, we don't know exactly how many are being done per day. However, what I think is important for the public to know is that we're going to handle this on a united front. And so the healthcare systems and the health department, myself included, will be part of early next week conversations about where are we at with testing right now? Where do we need to be in the next month? What will it take for us to get there? So that we will, by next week, have more information to share with the public about what our testing capacities are locally here. So we're working on that answer.
And then I just have another question on a different topic. We're seeing a lot of birthday parades out there, folks driving, obviously doing their best to social distance, but still kind of celebrate other folks. What are kind of the rules on that? Because I know we had some back and forth earlier this week with window visits and the elderly. What would you advise folks to do and how to stay safe during that?
Yeah, so the question is what is the advice about how to safely do things like window shout outs from your car, for example, for birthdays and things like that? Well, first and foremost, I think it's really delightful that we are still trying to celebrate things that are worth celebrating. When I look at what's happened this past week, particularly thinking about long-term care facilities and the conversation around the window visits, I think predominantly the concern there was that folks were opening their windows and having contact through the screen, maybe even, you know, kissing a loved one through the screen. So it's really about the social distancing aspect. So we can do those creative things in a safe way, and that really is about distance and being at least 6 feet away from others. And we should still be wearing our face coverings when we're out and about. I think that's a really important way to prevent the spread, particularly with the notion that people cannot have symptoms and still be spreading the virus. So I think if we're taking those precautions, we're really in good shape, and we can be creative, but we have to do that safely.
And Jen, we're getting some questions on our live stream on Facebook about gloves also. I know we've talked a lot about cloth face coverings, but could you comment on the use of gloves when you're out and about?
Sure. So the question is about the use of gloves. So again, what we're looking at here is the way that the virus spreads and what we know about how it spreads. Predominantly, it spreads through droplets. So when we're talking or we're coughing or those droplets are coming out of our mouth. And I think when those droplets might settle on surfaces, perhaps then individuals feel like if they are wearing gloves, they may be less likely to touch their face. So we want to avoid touching surfaces that might be contaminated, which we may never know exactly which surfaces are contaminated or not, and then not touching our face after doing that, or not touching, I've talked before about if we're drinking or eating, we want to make sure we've washed our hands with soap and water prior to eating or drinking to reduce the chance that something's on your hands and you contaminate yourself. So if we're wearing gloves, that's totally fine if individuals want to do that, but do recognize that your gloves can become contaminated just like your hands can. And if you are touching your face with your gloved hand, it's no different than if you're touching your face without gloves on. So I think it is a mechanism we can use to protect our hands from getting contaminated, but it is not, you know, it doesn't replace the need to continue to carefully make sure we're not touching our face, that we're washing our hands with soap and water, particularly before we eat and drink.
I have a few more questions for you, Jen, but just to start off with, I wanted to kind of go back to what you had talked about with the stay-at-home order extension. What do you say to people that are kind of pushing back against it, considering we have relatively few cases in La Crosse County compared to other places like, say, Madison or Milwaukee, for example?
So I've thought a lot about this question, and just to repeat, the question is, what do I say to individuals that might be pushing against the extension to the safer at home order? You know, I am the type of person that likes to look at things from both angles, and I can see both perspectives. However, I know that if, let's just say, for example, we had a magic wand and could say we weren't going to have an extension to that order here, which we don't have the ability to say or do. And then we would go about our regular travel. I think we would have individuals in our community that would be traveling to places like Madison and Milwaukee. People have family there. We would be traveling to locations outside of our state. We can't globally reduce the spread of this virus without having a mechanism to assure that we are not causing more harm than good. So I think that the extension to the order is necessary. I understand how difficult it is. I do, because I'm following the same directions as everyone else is, maybe more so, to include having a child's birthday and not being able to have household members over, and having to have tough conversations with even my own pastor, for example, who traveled and needed to be quarantined. So I understand how difficult it is. I really do. But I think that we have all put in a lot of time and energy so far to assure that our case numbers would stay low. And I've talked before about the importance of the timing of when the safer at home order came into effect. So again, you can see, and I'll ask my staff to post that on social media so you can see that chart. But there is an important chart that shows when the original safer at home order came into play and went into effect, and the case number and rate that we've had in La Crosse County compared to the state. And it is drastically different. And that is because those cases were already in the state when that happened. And in Madison and Milwaukee and other areas, we were able to contain the spread to those areas. And so we don't have more than 26 cases. But if that had not happened, we would not have spread or contained the spread, and we would have a lot more cases. So if we were to just open up and have no safer at home extension for La Crosse County, you really can't do that well and keep case numbers down unless it's at a statewide level. So it's tough to understand that when you live in La Crosse County and there's only 26 cases, and Madison and Milwaukee have a lot more cases, but people do travel, and maybe that isn't you or your neighbor, but it could be somebody down the road and they go to the same store as you. So there are unintended consequences of every policy action. And I think that it's always a balance between which unintended consequences are better than others. And so I think that I would say to folks, coming back around to the original question, I would say, please stay patient with us. This is not easy for anyone, but I think it is really important because we have a low number of cases for a reason. That does not mean we don't have more cases out there. It only tells part of the story. There is a lot of risk yet with this virus, and we need to protect the public and each other. And I need to protect other people's household members, and everyone has to do their part. And the only way we can do that is to stay united, to remember that this is not a fight against each other. This is a fight against a virus that we can't see. And we need to come out of this in a way that says we didn't waste the energy and sacrifice that we put in the first month of this order, that we didn't waste that, and that we kept numbers down, and we made this better for us. 6 months from now, we can look back hopefully and say, it did make a difference. I'd rather stick with this for a total of 2 months than have to continue with this cases popping up and reaching new heights over the course of the next 6 to 12 months. So that's not to say it's going to go away entirely. We are going to have a new normal even after the safer at home extension of the order. We're going to need to keep washing our hands, and we're going to need to keep being cautious with our distancing to each other and making sure we're not spreading disease. Those are good habits to have. But I think we will get through this, and remember that we're fighting against a virus and not each other.
Kind of speaking on, trying to get back to normalcy, you brought up earlier that, some of these non-essential businesses are starting to open up. What does that mean for our communities that have really struggled this past few weeks in terms of, trying to keep their businesses, trying to keep their livelihoods, and at least getting back on some sort of track to more or less kind of make a living in a sense?
Yeah, so I think the question is about what this might mean for those non-essential businesses that can do some, they can do some things now once the extension to the order goes into effect on the 24th. I think that is a good sign. I think we need to reopen businesses in a multi-phased way to assure that we can be safe. And also it is about balance to make sure that people can still have a livelihood. I think that's really important. And I want folks to understand that I recognize that. I know people who own small businesses. That's really tough. I'm married to a farmer, so I understand those things. But I think opening small like that gives them a chance to be able to bring in some revenue, hopefully, and sort of bide time until we get a full opening.
Any other questions for Jen today or Dr. Mahr? I see we have one more.
I have one more, I promise. But I know you've brought this up in other press briefings as well, but one thing I wanted to just kind of wanted to kind of reiterate is if you do have a family member that is sick with COVID-19 and you do work for one of these essential businesses, should you, well, obviously, you should quarantine yourself instead of going to work, even though you might not be showing those symptoms, correct? And I guess what kind of process would you do to more or less kind of inform your employers on that situation?
Yeah, so the question is, let's say that you're someone who has a household member who has symptoms, and I'm going to make the assumption, Justin, that that household member has a lab confirmed case of COVID-19. That may or may not be the case. So there are some pieces here that may require talking through to determine your risk level and what actions you should take. And we're always happy to talk you through those situations. But let's say that someone in the household has COVID-19. First of all, we'd want to ask, just like we talked about on Wednesday, that we'd want to have that person try to be in isolation within their house so that they're not exposing other members of their family. But then, yes, let's say that it's my family member. I would want to try to quarantine myself by not going out and doing essential travel unless I have no other means to do that. I would want to make sure that I'm cleaning my house thoroughly in a way that decreases where that individual might have been, surfaces they may have touched, in order to decrease the chance that the virus is present on surfaces and I pick the virus up and contaminate myself, or kids or others in the household do the same. So those are some of the actions that you can take. And as far as work goes, I would say, while we aren't technically restricting the movement of those individuals, I think, especially if they don't have symptoms, I think if there is the ability to work from home, that's generally the message that we're recommending right now anyways, is that if they can reduce the need to go outside of the home until the case has cleared up and no one is symptomatic, and we meet those criteria, I think that's best. And oftentimes, I think just having that conversation with the employer, for most individuals we've spoken with, that's worked out fine. There have been some situations where they have needed some kind of confirmation, and whenever possible, we, when it's appropriate, can provide some guidance for how to address that, and have even been able to offer a letter, for example, that someone can share with their employer that indicates their risk level. So there are ways that we work through those situations with individuals in those positions.
Okay, I'm not seeing any other questions.
Well, thank you all. It is Friday, and I sure hope that you take some time to get outside, spend some time with nature, social distance appropriately, but hug your family members that are in your household, and spend some time with your pets, and find joy in the common things that we have access to. And I wish you a very good weekend, and we'll see you back here on Monday.